Welcome to Carolina Beat, everyone. I'm over here with Dr. Bernard from Wilmington Treatment Centre, and we're talking a little bit about addiction. Now, I want everyone to really sit back and absorb this, because this is about, maybe you've got a loved one, or maybe you have a next door neighbour that you really love and you can see there's been a change in their life. And I wanted to have this discussion today because I feel that you said to me last time we met, Doctor, that North Carolina ranks pretty high in the addiction process in America.
And getting higher.
And getting higher. I want to ask you a question when it comes to addiction. Why are teenagers, let's say teenagers to begin with, what's causing them to become addicted? Do they start it out as just being fun, smoking a bit of pot to begin with, then they have a couple of drinks and then they go to the harder stuff and it gets harder and harder and harder?
I think you hit the nail on the head. It's experimentation.
Okay.
And then they have pleasurable responses. I mean, addictive substances can be pleasurable.
Yeah.
And they grow attached to them and they use them over and over again. And the teenage brain is very vulnerable to addictive substances. And so over time, the brain changes from wanting these drugs to needing these drugs, and that's when they find they're in trouble.
Wanting and needing are two huge differences. All right, what's addiction?
You know, there's many definitions, but the easiest one to talk about, it's a chronic, relapsing, and it's a brain disease, which means
it's a disease.
And disease is the most important part. And I like to talk about the 3 C's. It manifests as compulsive use of addictive substances, loss of control of these substances when you start using them, and as a result of addictive substances, you get consequences in your life, like failing grades, loss of job, loss of relationships, loss of life.
I want to ask you, when someone says to you, oh, don't worry, I don't do the hard stuff, I only drink.
So well, first of all, alcohol is a horrible drug when used inappropriately.
Yeah. And
secondly, I say you don't do the hard stuff yet, which means you're eligible to. You know, it's a process that you slide into addictive substances.
Yeah.
If you don't have alcohol and you're an addict, you'll go to a different substance.
Okay, let's talk a little bit about Wilmington Treatment Centre. What is MAT? M-A-T.
So
explain that to me.
MAT stands for Medication Assisted Therapy.
Okay.
And for many years, people would come to a place like ours and get abstinent and then go out and do NA or AA and no other substances. But we find studies have shown there's an 80% relapse rate with that kind of scenario.
I would imagine.
So now we do the exact same thing, except we add medication-assisted therapy on the back end for alcohol use disorders and opiate use disorders.
Okay, what type of mats are available then?
Well, for alcohol, there's primarily 4. There's the age-old antabuse that was out in the 1950s, and there's naltrexone both orally and via an injection, and there's a drug that's very prominent in Europe called Camprel.
Okay.
And for opiates, there's buprenorphine, or people know it as Suboxone, methadone, and an injectable form of naltrexone called Vivitrol. Okay.
I want you to give the audience at home an understanding. If you're sitting at home right now, as I said, if you feel that you have a loved one that may be going through this, the phone number's up on the screen. What do they do? What's the first step? We both know that all it takes is a phone call. I get that. What's the next step?
So
getting that loved one in.
Well, someone would call, and we have a wonderful staff that's very receptive, very understanding, very non-judgmental.
Yeah.
We get the person in the door, and they undergo a quick evaluation to see how bad their problem is, because some people will require very intense medical detox in our medical detox facility, and some people are substances that don't require withdrawal, and they'll go to a low level of care.
Okay.
So it's like a dealing out of cards from the admissions office.
But it's basically an analysis to begin with. Does the patient have the option to walk out?
Yes.
If they don't want this treatment?
Voluntary program, walk out anytime they want, 24 hours a day. Now, we encourage them to stay.
Of course.
But if they decide to go, they're free to go at any time.
All right. Well, Doctor, will you come back for more conversation?
Sure.
I'd appreciate that. If you want to find out more, there it all is up on the screen for you, everyone. Wilmington Treatment Centre. If you have a loved one or someone that you know or someone you may work with that you feel that they might need some treatment and you want to go along with them to give them a helping hand, give them a call. Back after this short break. Thank you.